we have been, our focus have been to continue to build the world-class unified data platform that makes the data AI and BI ready to help some of those use cases that we are delivering for the either cost compliance, cost savings, compliance, and improving the care delivery. But at the same time, as you can see in the roadmap, we are continuously adding more and more features and capability around the AI agents and the biz apps, which are key to leverage some of those data and information to help with closing gaps or improving operations and the cost savings. So our roadmap, as you can see, is a vision is that we believe, and we are continuously working on that with a combination of a curated data platform and an AI agentic platform can really help in delivering lower cost of care, can really help in reducing the provider burnout, and can really help with that enhanced decision making. So that has been our thesis and the vision that we are driving at. So I'm really excited to share that some of the features that we have launched over the last 30 days. And also, as you can see, that we are continuously innovating and iterating in making this product helpful for customers. So in the last month, we have released from a unified data platform perspective, we are continuing to add more and more connectors. The reason we see is that one of the biggest challenge around getting data and the data silos is to have the fastest way to get the data ingested in the platform and help connect the data to a meaningful use for AI and BI workloads. So to that effect, our vision has been to build a robust set of connector ecosystem. So we are continuously adding more and more connectors to help get data from the EMR using FHIR, other standards, or help get data from your financial system and other operational systems so that we can leverage to connect this data and build the AI or enable the AI workloads on top of it. We have also continued to improve our integrations with our underlying data foundations by having deeper integration with the Unity catalog. Our platform sits on top of the Databricks, and as Databricks are releasing new capabilities, our platform, we are continuously integrating those capabilities as a part of our platform. Regarding the business app side, we have already launched the Care Manager, or LEA, that's an overlay that sits on top of your EHR and can really pull in the patient 360 information and all the care timelines. With this release, what we have done is that we have made two significant improvements. We have added now the risk scoring, so ability to identify some of the risk scores like readmission risk or any care gaps they have. And the second is that we have also added a full screen capability with LEA. So it is a Chrome plugin that sits on top of your browser, but with a full screen mode, it can have a bigger window, and now you can see the entire patient 360 that has been compiled from the data that we have received in the platform. So in a sense, for a caregiver, the value would be for them to see the single pane glass or view of the patient's timeline, their care gaps, and any potential risk scores of readmission and LACE index, so on and so forth, that they can see it while at the point of care. We are also have launched the private preview version of the care management backend, we call it. So as a care manager, a LEA care manager, which is a very patient-centric, where they can see the care gaps and close the care gaps, the care management side of it, which we call the backend, is where it leverages all the data or the patient 360 data in the platform and can provide the information about how the populations are being managed. And this is very critical from a value-based care perspective, where the payers and providers together are taking care of the population. It is important from a population management perspective to understand where those care gaps are, how the care gaps are being closed, and the most importantly, how does it impact from a reimbursement perspective. We are also, in last month, improved our prior authorization and the referral offerings. So a lot of the, in our prior authorization that we had released at the first iteration, we have now added a capability for the caregiver or the clinic staff to be able to see the prior authorization content that is pulled together by the AI engine, and they can edit it before that prior authorization packets get sent out to the payers. Similarly, in the referral agents, we have made some improvements to be able to now integrate with the multiple index systems. For example, you're getting data from either faxes or if you're getting data from the email, now it can connect to those channels to be able to scan through those information and pull together all the referral components of it from a workflow perspective. And also it has integration with the prior authorization to be able to trigger prior authorization if any specific referral needs a prior authorization workflow as well. So with that, I'm going to jump into some of the demo of the platform to show how this all came together. And we are continuously iterating on this and would love to hear your feedback and your requirements so that we can continue to improve this product. So from a LEA care manager perspective, this is a dummy EHR. So currently we have a plugin, Chrome plugin, and as soon as you launch the Chrome plugin, this would read the patient's information on the screen and will connect to the backend system where we had pulled together all the patient information, has compiled the patient 360-degree view with their longitudinal timelines. And on top of it, it will run AI agents to be able to read through the data, identify the care gaps, and also identify certain risk scores. So with this release now, you can see the different risk scores. For example, if a particular patient has a high risk of readmission, if they are in the long-term care or in the post-acute scenario, this can go through that data and identify those risks for the caregiver to address those. From a value-based care perspective, now the platform has the ability to read through not only the structured information in the EHR, but also scan through the clinical notes and find out any care gaps or diagnosis gaps. Those are not properly recorded. The value of this identification is, number one, It helps the caregiver to close the gaps from a care perspective, but it also helps in screwing up or the identification of their risk score or the RAF, and that has a direct impact to the reimbursement. So this is one of the feature that now connects the payer providers to be able to understand those care gaps, close those care gaps in a value-based care setting. We have also added a feature called chart review. So as soon as you click the chart review, as you can see, this widget will now get into a full screen mode. And the beauty of this feature is that it now brings in the entire patient 360 information that is compiled from different data sources, and we have built the patient longitudinal records already in the backend systems. So those information is now displayed as a single screen view for the caregiver to see all the information, whether they have any their insurance coverage, their last encounter, what are their different diagnoses, and the problem list. These informations are typically in different parts and segments of the EHR, and sometimes those care gaps which are coming from different systems are stored in different systems. So this helps to pull all together into one single patient 360 view. It also provides an AI summary. So this really helps for the caregiver. Either they are reviewing the chart to get a quick summary of the patient and what their visits are and what are their key areas from a care perspective that the caregiver needs to address. And when you click the close screen view, it gets out of the way, and then you are back into the EHR workflow. So the vision and the approach we took from a platform perspective is that we want to make sure that our platform seamlessly weaves into the clinical workflow or the workflow that's already in place. So that we can reduce the friction from the caregiver perspective to as they are going through their workflow and their task, this should weave into what they are doing on a day-to-day basis, but reducing their burden of getting into multiple systems or reading information from multiple systems. Now, the backend side of the value-based care or the care management, and this is our private preview mode of it that we have launched, is this sits on top of all the patient 360 data that has been pulled together from the EHR system and from either the social determinants of health, if it's captured in other systems, and also scanning through their chart notes and the claims informations coming from payer as well. So this, what it does is that it pulls together to the risk of the population. So in a value-based care setting, it is critical to know what the population they are managing and what is their current risk adjustment scores of their population, and what is their HCC capture rate. Are they really tracking those care gaps? Are they really closing those care gaps? And what is the impact of closing those gaps from a revenue or reimbursement perspective? So this is a really powerful tool that connects all this data and provides we call it a single pane of glass view of how the value-based care setting arrangement is going on from a revenue perspective and the care gap perspective, closure perspective, of care management perspective. We're really proud of this feature. We will continue to iterate this and make it actionable for our customers to leverage this data and the AI to be able to really have an impact in the cost as well as from the revenue perspective. We had launched a referral feature as well a couple of sprints ago, or last month we showed it. So this is more extension of that. So we are continuing to add more and more features into it as we are getting feedback from our customers. So one of the capability that we have added here is we are now reading through all the referral content and able to provide a much more targeted summary that is helpful for the caregiver to really understand what the chief complains about and what has been done so far before they were referred to these providers. So that is one aspect of it. This AI summary section, we're going to continue to refine and add more and more meaningful information. The idea is, and the goal is that instead of the caregiver or the clinical staff to be able to go through all those attachments and PDF, if we can reduce that burden and bring those information synthesized for the caregiver to be able to read through and understand the referral. This also now integrates with the prior authorization component. So in a sense, this will automatically find out if a referral needs a prior authorization, and if it needs a prior authorization, it will trigger the prior authorization agent. So a caregiver or the staff to be able to, when they see this referral, they would know what is the status of the prior authorization that is happening as well. And these two features will get connected as they come into here. And when you pull up the care management, so they should be able to see this referral tab once it is integrated to see what is the status of referral happening or what is the status of their prior authorization. So this particular component will not only show the prior authorization that is either in process or being done, but also this will show the any prior, have a capability to trigger any prior authorization request as well. So these are some of the release items that we have done the last month. Coming back to roadmap, we are one of the things that we are actively working on and will be coming up in the next release is that we have a Senior Living 365 component, which brings all this different AI agents and the insights into single pane of glass to be able to see how it's the operational data, operational insights, and actionable insights in managing a senior living community. So we are actively working on that, and we'll share it in our next upcoming releases. With that, we've covered some of the aspects in the last month's release. Really excited about some of the changes, some of the new features that we have launched, and we'll love to hear your thoughts and feedback of how we can make it better, or the feature that you feel it'll be really helpful in improving your workflow or your productivity.